right, it's almost summertime, and the weather is finally getting nicer, although we will have some clouds this week, but still, it's warmer. We all need to remind ourselves, if you're going out to the soccer games or picnics, you need to wear the sunscreen. Today is Melanoma Monday, and we are all wearing orange to raise awareness about skin cancer because it's Skin Cancer Awareness Month. So Dr. Cohen was happy to come in and talk about this. You've been around in Denver for a long time. You've seen a lot of spots turn into something, haven't you?
We have, and unfortunately our rates of melanoma are actually quite a bit higher than the national averages.
Really? I was reading something today that it's the 5th most commonly diagnosed cancer in Colorado, or is it higher than that even?
That could be correct. I know it's the most common cancer among young adults aged 25 to 29, and many people have this perception that you see skin cancers late, and that's the case with some of the less dangerous forms of skin cancer, basal cell and squamous cell, but melanoma is something that we can see early, and just spending a few minutes in front of the mirror every month can actually save a life.
You know, you do see the spots in pamphlets at the dermatologist's office or on the news about the different kinds of moles and things to be looking at, and you know, you may be like, oh, I might have something like that, or I've had something like that for a long time. How do you know when to go in, or do you just go in?
So it is recommended that everybody go in for a yearly skin exam, and that was previously the most common type of skin cancer called a basal cell carcinoma. This is a squamous cell carcinoma. And what you're speaking of is melanoma, where this photo shows irregularity in pigment, irregularity in borders, and most importantly, this is something that is usually changing. Somebody notices a spot, it's getting larger, it's getting darker or crusted.
Okay, all right, you brought some things in here. This is what you dermatologists use to kind of look closer, because I may see a freckle that thing's really dark and but you say it's nothing after looking at that.
So this is called a dermatoscope, and what it does is it polarizes the light, so we can look at pigmentation and look for pigment networks, and that looks okay.
That looks okay.
So, and it's really helpful to have this in our toolbox because it really does facilitate diagnosis. It helps us decide when to biopsy something or when not to biopsy something. So other props, sun protection is very important. People tend to pay attention just to the SPF number, but that really is only something that protects against UVB, which is the tanning rays, which is really the rays that make people sunburn. So UVA are the rays that actually penetrate deeper and are more associated with some of the skin cancers. So we really need to look for something that says broad spectrum sunscreen, so that has UVA. If you want to look for two key ingredients, either zinc or titanium, those are things that protect against UVA as well.
Okay. The number doesn't matter. You always hear, oh, anything past 30 you don't need to waste your time on. But
That's
what
correct.
do you think?
Anything past 30 doesn't give you that much more protection.
You got to wear something, even on cloudy days in Denver.
That's correct. And really, you have to apply the right sunscreen with the right ingredients, number one. People should apply it about 20 minutes before they go out. For the face, a gumball size of sunscreen is appropriate, and for the body, really a golf ball size of sunscreen is appropriate.
Gumball and golf ball. And what is this that you brought here, too?
And reapplying every couple of hours. And this is a sun protective pill we're going to hear more of in the next few months. This is meant to be used only in addition to sunscreen. It's in combination with sunscreen, it can be more effective. It's a South American fern that they've known for many years has sun protective qualities. There's more studies coming out. And it's going into national pharmacies now.
Okay, well, thanks so much for coming in, Dr. Cohen. Wear your sunscreen today, Shapiro.
Okay. I try to do that. Yes, indeed. 7:39. The pill is really interesting. I hadn't heard that.